Hey everybody, and welcome back to the channel. Today we are watching The Pitt. Episode, I kind of did that intentionally.
What intentionally?
Well, I thought we could maybe say that and then pause and then have an intro or something where we're like throwing things and then come back to it,
Throwing things?
I don't know. We'll just roll with it. Anyway, today we're watching another episode of The Pitt. This is episode 11, I think. So we're on the final, the home stretch, I think. I just want to, last episode kind of ended, and I was a little bit, I don't know that we commented much about the whole Langdon issue at the end or not. I guess I was just kind of shell-shocked from all that. I just wanted to say, the acting in this show has been absolutely phenomenal. Whoever plays Langdon, the desperation, in his his pleading and his, I don't know, it was very authentic.
Yeah.
Right? It was really, really sad. I think obviously a different type of sad, right? We didn't lose a life, but
I know, I felt bad for him.
You see this amazing talent. And again, I think the show has just done a good job highlighting that amazingly talented person who clearly has a disease in his own right, and it doesn't appear that the drugs have impaired him, but
maybe affecting his mood.
Oh, well, I'm sure.
Yeah.
So anyway, I hope we don't see the last of him. I know that image of him walking out of the hospital, holding his clothes.
Yeah.
That was a pretty powerful image. So anyway, the acting in the show has been amazing. I mean, Dr. Robbie, the whole cast, obviously they've won lots of Emmys. You guys did a really, so you guys actually, in the comments, I've learned that there were more Emmys won. So Dr. Abbott won an Emmy for, I guess, a supporting character or supporting role. Because obviously he hasn't had a huge role in the show except from the very first episode. And I don't know if he comes back or not, but maybe a change of shift again.
Yeah.
But that, I don't know, that's been awesome. And then we have some, personal exciting news with yesterday I got the notification from YouTube that we hit 750 subscribers. So thank you so much. That was just so exciting to see that. As we start filming here today, I think we have 754 or something. So to all of you who've helped make that possible, thank you so much. And anyone who's new here, consider hitting the subscribe button because we would very much appreciate it. As we dive in here to another episode of The Pitt. So, by the way, I am Dr. Todd.
I'm his lovely wife, Alicia.
Yeah, maybe we can push that.
It's fine.
Cut that out.
It's fine.
Anyway, so. All right, enough of that. Let's get into it. Anything else before we do?
No.
Excited to get it going? All right, let's do it.
So the aftermath, they're starting right back off from firing Langdon.
Yeah.
Yeah.
Hey!
Not now, Myrna.
Oh.
My shift, if I get home before 6, Benji, you'll know something's up.
Pretty sure the black eye's gonna give you away.
Yeah.
Out just like a sandwich.
Better not be pineapple.
No pineapple, I promise not this time, okay? We good?
Oh.
I need you to run a pharmacy audit on Langdon for the last 3 days.
I want to know why.
I think you kind of know why.
Yeah.
You sure you're still good to stay?
Yeah, are you?
Honestly, I'm beginning to have my doubts.
You feel like God's trying to tell you something?
Is he getting rid of evidence? No. I know he wants to help him, but that's not going to help.
I understand. Yeah, I get why he wants to do it. I would want to do it.
He's definitely got some PTSD from losing his mentor.
Yeah, it's definitely akin to that.
Akin.
So I don't know if the ER is different, but all the ER staff seems to use public restrooms, which probably is not super smart. Go in a bathroom that a patient could follow you into.
Yeah.
Trust you have not mentioned this to anybody else.
No, I don't know any.
Keep it that way.
Who's she calling?
I think that the surgeon that she's become kind of connected to.
Oh,
Did you hear from Dave?
No,
All I ever wanted was to fit in.
I heard Langdon left.
In the waiting room, I will come and find you. We will finish this conversation, I promise.
oh my gosh. There's a lot going on in one shift.
I had a miscarriage. I was trying on my own with IVF.
Okay.
BP's 112/72, heart rate 84.
Dr. Collins, can I join?
Sure. Action
They're going to
starts
keep giving
yesterday.
Collins all pregnancy related
Yeah.
cases.
Natalie, I'm here. Sorry, I got a little lost.
Check her, Dr. King.
They're going to make her deliver a baby.
I see hair.
Oh. Specific.
Babies.
Specifically.
Natalie, you're crowning.
I hear we're down a senior resident. How can I help?
Is this all about the fight?
Fight.
Robbie and Langdon got into it at the lockers.
That's enough from you two. Not another word.
Ay, cosa sabong dito.
Keep it up.
I always wanted to be one of those people that popped out with a different language, you know? That's not me, though.
Could be.
You got here just in time. We're the dads. Natalie's my best friend and surrogate.
Oh, okay. Surrogate.
It's time.
Got this.
3, 2.
What do we have in here?
3, 2, skip scene.
55 has experienced a day of abdominal cramps, vomiting, and diarrhea. A febrile, tachy at 124, BP 192/100.
Tacky, fast heart rate.
Heart rate's very fast, blood pressure's very high.
Oh, so it means two things, or you're just
Well,
saying?
no,
Okay.
they said his blood pressure was high.
My daughter's getting married. Not a big drinker.
Any recreational drugs, either pills or by injection? Tranquilizers, hallucinogens, painkillers?
All of the above.
All right.
I'm kidding. No drugs. Never.
So what's your plan?
Besides Zofran, CBC, CMP, IV fluids, morphine, maybe CT.
A drug tox screen.
Remember how I said you get good at spotting the fakers?
Yeah.
He's exhibiting every sign of opiate withdrawal.
Dilated, tearing.
Ready? Why don't we all take a deep breath, huh? Everybody.
Oh, are you taking one too?
You broke your ankle doing something stupid with our son. Be a grown-up. You're his father, not his friend. You think? Oh my God.
Hey, babe.
Are you not allowed to go skateboarding with your kid?
I agree. Like, obviously, you want to promote like safety, helmets, pads.
Yeah.
I never wore any of those things. My parents weren't trying to kill us.
I know.
I do like that the shirt says bonus mom.
Harrison is going to stay with Cassie for a little while.
No. I'm here.
Oh.
You're trauma one. We need you. We are not done here.
48-year-old cirrhotic here for hematemesis.
Vomiting blood.
Intubated
Okay.
after 1
Yeah,
minute.
I didn't know
therapy
it.
season,
Oh, well, I
FFP
can
was
see now.
supposedly stable. Not anymore. Weak carotid. Shavati?
How many
Knee
vomiting
section?
bloods have you seen?
You're bleeding all of a sudden.
Likely
Ew.
bleeding is for
I always know every time there's a scene of someone coughing up blood in a movie, you always make fun of it.
Yeah, that's different. It's like every time anything happens. in a
Write that
movie-
down. Talk more about it.
Robert's maneuver. Of course. Natalie, we're gonna lift your knees up to your chest now.
Great.
Justin?
I mean, can you do a C-section when the baby's already heads out? Can't.
Yeah, you're gonna have to ask an OB.
Can you page the OR and tell them to prep for a possible crash C-section?
Only
Okay,
82
so
over
you can.
46.
But
Hey, Mom, you're gonna
I
be
don't know.
okay.
I do not know.
80 pantroprazole and ceftriaxone.
all I know is those
Hurry up,
contractions
get
are
Robbie in here.
super painful.
Are they?
Yeah. Like I could feel it when she
Oh,
was having
you,
them.
you were like having like sympathy
Yes.
contractions.
Yes. Oh no.
That hurts.
Release that lower arm.
3 minutes since that delivery.
Dr. Robbie.
I know it's not real, but the poor little baby didn't look good.
What about
Oh, she got it.
You're right there. Give me one good push.
Yeah, baby boy.
Yeah.
Congratulations, everyone.
He's not crying. Did he cry though?
Sometimes it takes a minute. Put the baby on a pulse
Oh
ox and a heart
no. Are
monitor.
they gonna kill this baby?
Hey, come on, baby.
Let's breathe.
1 minute Apgar is 3.
Oh, that's not good.
I mean, the visual effects on this show, man.
Are we gearing up for another one of these?
Because your canister's full.
I'm on it.
Second runs the length of the esophagus for direct pressure.
She's bleeding from her stomach.
Esophagus.
Oh, esophagus.
Yeah, so with cirrhosis, you get what's called portal hypertension, which dilates the veins in the esophagus, and then they have a tendency to bleed.
That's a lot of blood.
That is a lot of
It
blood.
was already filled.
These will bleed very, very profoundly.
Works the same way and goes right under your tongue. Leave it there and let it dissolve. We'll be back in 10 minutes.
What is this that she's put under his tongue?
I didn't catch it.
Our plan is lying to patients.
Is a morphine-like drug, binds to the same receptor.
Oh.
Once he feels better, we can get him to admit to his addiction and treat him long-term.
Is that a strategy? You don't know.
I wouldn't personally do that, but
You gotta be kidding me.
Princess Answer told me you were busy. Just wanted you to know.
Okay, noted.
I think they used to, I heard a story that they used to like attach these balloons to like a football helmet. And so you would have the dilated balloon and then you had to have tension on it. So they would attach it to like a helmet that they would wear. Like,
Apgar is now 10.
Go on.
Yeah.
Yeah.
Whenever you're ready.
it looks familiar. That nurse almost looked like Chris Brown.
Oh, really?
It was like, she do like a cameo in here?
Here it comes.
Oh, wow.
Oh, no.
Hemorrhage. See, nothing ever goes according to plan.
And sometimes we
Not
have
on
to
this
have the
show.
uterus clamp back down. Starting uterine massage, 40 of oxytocin.
Okay, I'll be right there. She's still bleeding higher up in the esophagus.
Natalie.
Got it.
Gosh.
We have to inflate the second balloon up in the esophagus to do the job.
Dr. Robbie.
Oh, my God.
I'm coming.
They could use Langdon right now.
Yeah. Maybe that's why he's like, let me come back.
Balloon stop the bleeding. Tomorrow, GI can cauterize the veins.
That was awesome.
You can talk to her. Get in there. Tell her some of your favorite memories with her. That'll help.
Thanks for coming down.
You said there was pizza.
Do you think she knew?
I don't think so.
You called me down to talk about it, but you don't want to talk about it.
You just...
I said stop. You're trouble.
What?
Yeah, I mean,
That's weird.
she obviously feels a loyalty to Langdon.
You're trouble.
Keep going. Keep talking to her. More memories. It'll help.
Craigslist, and we went to go pick it up, and they mugged us, and they stole it back from us.
Estimated.
This seemed like a fun story.
Before the finale, because of FOMO.
Natalie. Hey, Natalie.
Not better. Nausea is gone.
Blood pressure and heart rate are back to normal.
Incredible. You sound surprised.
Oh, no, I'm just relieved for you. So.
Nice save, Dr. Rabinovich. Dr. Collins.
Pulse ox 99, BP 102/68.
Maybe they'd let me have like a cameo doctor role here. Or just like walk in after they've done something awesome and be like, good job, guys. This was great. Call me if you need me.
Thanks, Dr. Robbie. Thank you, Dr. Collins.
Excuse me.
BP's 98/70, heart rate's 104.
He's the guy that calls out the vitals.
Yeah. Like an anesthesiologist or something?
I don't know what his role is.
I don't know.
She got clean the day that she found out she was pregnant with me, and she's the best. Are you close with your mom?
Sure, yeah.
Kind of. As long as I please her.
Like proximity-wise. It's just not the first word that comes to mind.
Dude, you gotta stop calling me, okay? Yeah. Okay. I'll
That
tell him.
Langdon again.
Yeah.
Want to say hi?
Hey, Jake, long time no see.
Oh no. I just had like feeling like this kid's
I was going to go shoot up
at
a festival.
a festival with his son.
That's Robbie.
Robbie, I'm Leah, Jake's
I got chills.
Premonition.
Yes, I
to
have
be
a
here with Jake,
premonition.
so thank you so much for letting me use your tickets. We're having a blast.
You're more than welcome.
I feel like that's the only reason they brought that in.
Do you know how much IVF costs?
Yeah, the emotional toll has got to be pretty hard to overcome.
I'm not sure I could go through this again.
Do you want me to go find Kiara?
Just want to be left alone.
Go home.
Well, there's another doctor. But I mean, she needs to go home.
I got pregnant a few years ago. I wasn't ready to be a mom then. I was afraid he'd hate me for being selfish.
Not selfish.
Is she talking about him?
I mean, I've felt all along that there was something. but
Yeah.
You want to show Harrison how an ultrasound works?
Sure, yeah. You want to see inside your guts?
Always.
Okay.
Always.
My mom.
Get a little alone time with Bonus mom.
Yeah.
This definitely violates the restraining order.
I tried to warn you. Harrison loves living with us. An 11-year-old needs stability.
She has a restraining order against her son?
No, I think the bonus mom has a restraining order against her.
He's 100% back.
And it feels like it was just a few hours ago. I was asking you, why didn't you consult me?
I was thinking about that
specifically,
too.
Is anybody honest about anything anymore? Or are we all just bullshitting our way through life?
It's just a case of...
That was rhetorical. Why didn't you come and find me?
You were a little busy.
Yeah, he was.
Really?
We're giving you a 7-day supply of a drug called Suboxone.
I'm not interested.
My father passed away when I was young. I'm glad your daughter has you there on her wedding day. I hope she gets to have you there for all of her other big days to come, too.
It's like every case affects each doctor on a personal level.
Yeah.
I don't always know the exact right thing to say, but I am sorry about your dad.
It was a long time ago, but thank you.
Needs to go home too.
Maybe. I think they all need to go home.
What if I'm wrong?
Then you apologize.
Yeah.
And we will help you explain that this came from concern for his safety.
If I become a petitioner, what am I doing to my son?
Getting him
Protecting
the help he
him.
needs.
Are trying to get him the help that it sounds like he needs.
Yeah. Wow.
David lost his father. That would affect anyone.
And Dr. Robbie, same wavelength, goes back to New Orleans.
You have kids?
Sort of have a stepson. Yeah.
Oh,
His mom and I
stepson.
dated for a while. Knock, knock.
Huh. To what do I owe this pleasure?
Louis.
I found these. You don't want these ending up in the wrong hands.
I'm digging my own grave. Let me.
I don't have to give you the shovel.
I don't have to give you
The shovel.
Oh.
Have you seen Dr. Langdon?
He left for the day.
Didn't say goodbye. I really wanted to tell him about this delivery. We're so happy and
Great stuff.
Dr. Man. Everybody cuts her off.
Happened with Langdon. If I hadn't said anything, he would still.
Nobody's fault but Langdon's. Some people might have turned a blind eye, but you didn't.
Okay. That's what the surgeon girl.
Yeah.
I'm horrible with names.
No, she's the one that I have a hard time with too.
Thanks, Dr. Abenovich.
Have you seen Dana?
So that was probably coming from a place of guilt. Mm-hmm.
keep your distance. I'm already in a bad mood.
I'm just getting some air.
Looking better at security.
Hey, now you're just being me.
Yeah, she is.
You do make a difference. One asshole doesn't get to change that.
I think I'm done.
Oh no.
You're a good man, Rabinovich. Don't let this place take that from you.
I'm getting nervous with the sirens in the background.
Well, they are at a hospital.
Code triage. Multiple GSWs. There's an active shooter at Pitt Fest.
I did call it.
Jake and his girlfriend in there.
Gosh.
Not that I want to see it, but it ends.
I know. Well then.
Well, Lucy.
I blame Lucy. Yeah.
Yeah, she caused this.
For those of you who don't get that reference, our good friend and cousin Lucy, your cousin,
yes,
my good friend, warned us. We kind of touched on this last episode that she had warned us that it gets worse, and I said no way. After the girl died of drowning, there was no way that this gets worse. It's just worse is a relative term. It's just different bad.
Well, there could be kids.
I'm a little bit scared.
Now there's going to be anxiety until the next episode.
I'm nervous to watch the next episode. We'll see. I mean, obviously, I think his son and girlfriend are likely involved in whatever has taken place there. Maybe not. Hardly matters. I mean, it matters obviously.
Well, they're
for the sake of the
there.
show, but it's just really sad that we live in a world where you can't go to a concert festival and be afraid of somebody bringing a gun, or to the supermarket, or to church, or school. Right. I mean, so anyway, that is a very heavy topic, and one that I will be dreading watching. So anyway, I mean, obviously another really emotionally tugging episode. You have the shoulder dystocia, the pregnancy complication. That was really hard. Obviously, all is well that ends well, so thankfully she's doing well. you had a kind of a more up my alley case was the esophageal varices bleeding.
Oh,
so
okay.
that's more like that's my kind of the thing that I would have dealt with when I was in the hospital. And so that was that one I could relate.
Because of internal med.
Well, yeah, and you're dealing with cirrhotic liver, and so now the acute hematemesis bleeding, that obviously is going to be handled either through like an ER setting or an intensivist setting, or bringing GI in to do that kind of what we call tamponade, that balloon tamponade, where you basically what's the thing we wrap around the arm?
Tourniquet?
Tourniquet, yes.
I do that one.
Yeah. Almost, I promise I do medicine. It's sort of like tourniqueting the vessels to get them to stop bleeding. You still have to go take care of it after that. Like that's only a temporizing measure. But anyway, that was a little more up my alley. So I did kind of appreciate that one. I don't do much with delivering babies, so can't really talk about that one. I didn't write down a whole lot, just a couple of little topics from this episode. I'm getting nervous for the way these shows are ending on really like heavy issues. Langdon walking out the door. Well, might want to bring him back, Robbie, because sounds like we're going to need all hands on deck here. Before I jump into what I wanted to say, was there any comments that you had?
No, they've touched on a lot of heavy topics. Well, they're now going to be touching on mass shooting. Yep. It seems. Guns. I mean, can we get hit every political topic? Gun control, mass shootings. They talked about abortion with what's her name? She was talking about Yeah. Which one of those do you want to put your stance on? I'm just kidding.
I know they hit these because medicine, and I think maybe the reason they're doing it is medicine, and we touched a little bit on this. Medicine is the place that all people come to, right? So regardless of your political affiliation, regardless of your belief system, none of that stuff matters really when you are in the hospital. And so I think they're hitting on that. Like, this is the common place that people come when they're unwell, when they're sick, when they have a need. And regardless of...
And there's no room for politics.
No, there really isn't. Like, you take care of everybody equally. That doesn't mean you don't have your biases of opinion, and doesn't mean you might not like, Dr. Santos when she went in and basically threatened the dad, right? Like, you touch your daughter again, right? Like, that's hardly political. Like, nobody should be touching, their children inappropriately or anybody inappropriately, frankly. So that's not really political, but the point is, like, she's projecting
her own bias.
Well, her bias maybe is the right word there, but like her own experience.
Yeah.
And so I did kind of write that down, personal experience, because you get Dr. Mohan kind of going into, like, kind of ripping into that guy. Like, I don't have my dad here. He's not going to walk me down the aisle. You have a chance to do better, so do better. So this happens all day long, right? All day long, I'll hear things that touch over into my own personal life, things I've experienced, things I've dealt with, things that maybe I'm actively struggling with. And now I don't show that. Like, I'm not going to make a statement like that. At least I hope I never do. I hope I never get angry or frustrated enough to do that, because it wouldn't be quite appropriate. But, like, I get it. I understand it. And so I did write that down, because I think this show is really, really highlighting those personal experiences and how they're affecting maybe they haven't said anything to the patient, but, like, you can see it on the face, right? Dr. Collins, all of these pregnancy-related issues that just keep getting thrown at her.
I think they're just trying to show that doctors, ER setting, all that is just human. Like, that they are human. Yeah. So they experience all of the things that come into the ER, their own personal life.
Well, yeah, it's, and I think, and look, at the surface level, nobody denies that. Like, there's not anybody out there who's saying, like, oh, I didn't realize doctors were people. But
they have to figure out a way to deal with that.
Yeah, but it is funny though, because, like, I remember having to call off a day and having to move my whole schedule because I was sick, right? I was home with the stomach virus. would have much rather been working. And I remember one of the patients that got moved, they came in to see me a couple weeks later, and they kind of joked. They were like, yeah, they called me and said, like, he's not going to be in. He's sick. They were like, what? Doctors can't get sick? They were joking, obviously.
Yeah.
But yeah, the same, right? So they think they're highlighting a little bit of that. Dana at the end there saying, I'm done. This has been a theme of the show as well. And I think like a lot of my understanding, a lot of the interviews with Dr. Robbie, because I've tried not to watch a lot of these things because we're in the process of this, but he has been very vocal and very supportive of healthcare and the fight against sort of violence against healthcare workers. And so, and she's right, you know, things seem different. I've noticed a shift.
Since residency, have you noticed a shift?
Yeah, I've noticed a shift. And I do think the mayhem of 2020 and COVID.
Yes. People are different.
I think has changed the way people behave in public and the way people engage socially. And I've noticed it, you know, in my own practice, like the mistreatment of nurses. I'm pretty lucky. I've not really had anybody really mistreat me. But most of the time, I feel like there is still that maintained level of respect. Now, granted, as a patient who comes in to see me, I guess there's probably something they want from me at the end of the day, right? Like they're looking for something, whether it's help, whether it's treatment or whatever. But the mistreatment towards nurses this is a growing problem, and it is why we are seeing nurses leave the field at historically high rates, and that is going to be very problematic.
Mm-hmm.
So I don't know, I mean, how you fix it other than just try to get people to behave like adults, you know, behave like reasonable human beings.
I'm sure that's a multifactorial solution, but one would be protecting the nurses.
Without question.
And healthcare workers.
Without question.
That's where you could start.
Without question. So I agree with that. I think this show has really highlighted that. I hope she doesn't leave, but maybe we'll see. And then the only other one, this is actually a more lighthearted one. So this episode kind of took that kind of darker turn. You made the comment about wanting to be someone who like could maybe hear the conversation that they're having and chime in. Right?
I so want to one day be able to do that.
So I actually was
not in a weird way. Like I'm listening to their conversation. I just think it'd be funny.
Yeah, like
a cool moment.
Well, so there's actually a guy, I don't know his name, but there's like a guy on like TikTok or something who does shorts where he does.
Oh yeah, where he like calls in.
Well, no, this guy like he'll be at restaurants and things like that.
Oh, okay. I don't think I've seen that.
Yeah, and he's like fluent in like all these different languages, and so he'll usually start talking to them speaking English, and then if they start saying something or whatever, he'll then run it off. It's always pretty funny or interesting to see the reaction because he does not look like he would speak all those languages. So, but anyway, I had this is really kind of a silly story, but there wasn't a moment where this happened to me. So I was in my pediatric rotation, and I was in the room with a Spanish-speaking patient, and the physician who I was with was also Spanish, like spoke Spanish as his maybe first language. And so he's talking to the patient, and so he starts communicating in Spanish because they both speak Spanish, and the patient prefers Spanish. And so the whole team's kind of standing there, and I assume most of the team has no idea what they're talking about. And I took several years of Spanish in high school and college, so I wouldn't call myself fluent, but I certainly can pick up on the gist of conversation. And so they were talking, and they had an appointment for follow-up after. It was like an asthma exacerbation or RSV or something. And they were going to follow up in the outpatient clinic. And I just know the patient, and I was listening, following along, and the patient said, I think KRS, which basically is like, what time was it? And he said, no sé, kind of turned, like basically saying, I don't know, like he didn't make the appointment. And I was just like, oh, it's at 1 p.m. And he kind of looked at me.
You got that moment once in your life.
And looked back at the patient, and he said, I don't know if it's, I actually don't know the time it was. But
you got to have that moment. It felt pretty cool, didn't it?
It did, yeah. Well, because then like looking back, it's like, oh, like I didn't even realize that I was just listening along, and I happened to know what she was saying. But anyway, yeah. So that was actually kind of cool. So I remember that. I think that's all I got today.
Yeah.
Thanks, Lucy. We're gonna see what happens next.
See what she caused.
I know.
The damage.
Yeah, we're just gonna blame it all on her now.
Yep.
Thanks for checking this out with us. Another really good, really heavy episode. I have a feeling the next one's gonna be kind of heavy too, so we might want to.
Maybe it won't.
We haven't had to use these since episode
Maybe it won't
8.
be heavy.
Yeah.
I've hardened off now.
Yeah, we'll see.
I no longer cry.
We'll see about that. All right, check it out with us next time. For now, thanks for being here. Take care.
See ya.
I am Dr. Todd.